Emily,
Hi.
thanks for coming on.
Of course.
I'm excited to do this podcast with you.
I'm really excited.
You've gone through a lot of stuff that a lot of women have gone through, including people that I've been close to.
Yeah.
And some of the things you've gone through have like directly affected family members of mine, and I get it. And
yeah.
Obviously, you and I are both sober, so
Yep.
that's it. So you've been sober how long?
I just got 6 years on August 16th.
Atta girl.
Mm-hmm.
Nice.
I know.
How's that feel?
It feels really good.
Yeah.
It feels like, it's just my life now, And it's exciting, and I'm very grateful, but it's also just my life now,
So I know, I don't mean to, be rude, but we're on a podcast, and this is to kind of, help people. How old were you when you got sober?
I was 23.
23?
Yes.
So you got sober in your early 20s?
Yes. Mm-hmm.
So tell me about that. Tell me about, that last day. What got you there? What was your, bottom moment where you're like, hey, I need to get it together?
It's actually really interesting. So I came out to California 7 years ago. It'll be 7 years in November. And
where'd you come from?
Boise, Idaho.
Oh, Idaho.
Mm-hmm.
Nice.
Yep. That's where all my family lives right now.
Gotcha.
So I came out to California, and I looked up treatment centers in Southern California that accept dogs, because I had to bring my dog. And
yeah, we talked to Carrie last time.
Yeah.
She had it was an emotional support snake. But you were just normal, had a dog, right?
Yeah, I had to bring my dog.
Uh-huh.
Emotional support snake. I love that. And I found a treatment center, and I came out to California, and I went through the full levels of care, detox, residential, PHP, IOP, OP. And during that time, I was dealing with a lot of the trauma that I was experiencing and everything. And so I wasn't really working any type of program. I honestly didn't even know that the steps were involved in meetings. I truly did not. And I also feel like you hear what you want to.
Sure.
So I'm sure people were talking about the steps, but I didn't hear it.
Yeah.
And so during that time, I was dry, as they say, and I wasn't living very clean, I was doing things like seeking arrangements, just, I was just being dirty. And I wrecked my car 2 times in one day, and I was just not doing good things, right? And I ended up meeting this guy. He's actually my fiance now. And I met this guy, and we started dating, and it was great. And then I had a miscarriage.
Okay.
And, like I said, I was sober, but, I didn't have any type of defense. And so I just started going a little bit crazy, I was just very depressed. And he told me, you have to work on yourself, and, we have to separate for now. And so I got high. That's how I wanted to work on myself, apparently. But I remember.
All right. So when you got high, what's your deal? What did you get high on?
Meth.
Okay.
Meth is my drug of choice.
Okay.
Yeah. So I started off drinking, and I went back to Idaho with my friend for a few days. And I started off drinking. It wasn't a big deal. I was smoking some weed.
So when you started drinking, did you make a deal with yourself you weren't going to do drugs?
Yes. So at that
that
time, I truly believed in my soul, everything, that I would never use meth again, no matter what I did. I felt it, never. And so that night when I was drunk, I was with these people that I used to hang out with, and I was in the back of a car, and they handed me the phone that had a line on it, and then, a little tutor. And they handed it to me, and as my head is going down to do the line, I was thinking to myself, what the fuck are you doing? What is happening right now?
Yeah.
And it was like my body couldn't control it. Like I had no defense and I had no power over it. And I didn't want to. I mean, of course there was, you're an addict. But I didn't want to at all. It wasn't what I wanted to do or went out to go do or anything. And I remember thinking like, okay, I'm completely powerless over this, And I think that that's what really hit me that time, having that realization that I don't have control over this.
Yeah, I have a real similar story. I relapsed after having 8 years in my 20s and made that deal. I'm just going to drink.
Yeah.
And I'm not going to do drugs.
Yeah.
And that night, smoked a joint and rationalized that, pot's not a drug. I'm not going to do any hard drugs. 4 days later, I'm in Vegas. Some guys are like, hey, you want to go do a bump? I'm like, yep.
Yeah.
And like that's the difference in me and you and like the normal person, because like normal people listen to this and that have a glass of wine at night or two and think, oh, how does that lead to that? That doesn't lead it for me.
Yeah.
Well, yeah, that's great, but it's not us.
Exactly.
And that's why we need all this stuff.
Yeah.
And then so you did that. You're powerless. And then how did that get to you to your first day clean?
So I think I stayed out in Idaho for maybe 3 days. And my dad drove me and my friend back. I don't remember why, but we were supposed to take a flight, I think, and then it just didn't turn out. And I remember driving back with my dad, and I played this song from Demi Lovato, Sober, and I'm sure that he knew at the time that I had relapsed. And but yeah, and then I remember going back. I was out of sober living, and I was like, okay, like I need to go to a treatment center, And at that time, I did not trust myself, and like that was something that I was so stuck on for so long during that time, because I was like, I can trust myself. I know I'll never use meth again.
Right.
And when you don't trust yourself and you had full confidence for so long that you were good and you realize that you weren't, you couldn't trust yourself, that was miserable for me. I didn't know what to do. I didn't know where to turn. I didn't know what to think. All of the things, And so I went to a treatment center, and I did whatever they told me to do, So.
Yeah, it worked out.
Yeah,
so we'll get more into that later. Okay, let's back up. Like,
okay.
You grew up in Idaho.
Yes.
Like, what was like family life for Emily when you were little? Like, was it normal family? Like,
very normal family.
Brothers and sisters? Normal. Like, what did it look like?
Yeah, I have one older sister.
Okay.
She's 3.5 years older than me. She's great. She, was more into like books and getting good grades. And, when it comes down to it, she was a great role model, and I did not accept that role model.
Right.
She went all through high school, college, grad school, straight A's. She's great. She's very intelligent, very smart, very, book smart.
Yeah.
My parents are wonderful. They're
still together?
Yes.
That's
yeah.
Neat.
They are the most loving people you could ever imagine.
Okay.
And yeah, I mean, I grew up great.
And you remember being happy as a little kid?
Oh, yeah. Yeah, very happy. Very happy, very supported. And then, I mean, I was even a really good kid up until I think it was 13 or 14.
So what were you into as a kid? Like, school, friends? Did you play sports?
Oh, friends, for sure.
Yeah.
I was always with friends. I mean, I was social butterfly, as my mom said. So. And
then 13, what happened?
13, I was in a group of friends, and, girls can be really mean. They decided one day that they didn't like me. I guess I was annoying. And these were my best friends. And so they started bullying me. They called me Great White Whale, GWW. which stands for Great White Whale. And they put like a used tampon on my locker, and they were just mean girls, you know? And I think that that's kind of what started like the depression. And around that time, I started getting in a lot of like physical pain. And I kind of stopped going to school, and the pain was a very weird pain that I hadn't experienced before.
That's so interesting. Like, you hear about bullying at school, and like when I was younger, that was like a thing. Like, you just got in a fist fight, you know, in like Texas, and but like that was your event. That probably like and that like shows how serious that is. With kids.
Oh, for
not
sure.
Doing that because you grew up in a happy home. Or a happy, enjoying life, and then all of a sudden. You got bullied, and that really was traumatizing for you. It affected your self-worth. And then you start looking for what? Like, you know, how to feel normal.
Absolutely. And so then I got another group of friends, and not that they were like bad kids or anything, but, you know, we tried weed, and it didn't really like stick for me. I don't know. Like, I was more into like going to parties and drinking. So then when I was like around freshman year, I was more so like going to parties and all that. And I was also still in pain. So I ended up dropping out of school because I just never went, because I was just in physical pain, and like no doctors could figure out why. And so then I met a guy. He was 2 years older than me. He was a very bad kid. Liked to steal, liked to, you know, all of that. And was into drugs and all that. And that changed everything for me. My first addiction was spice, or K12. It's like the synthetic marijuana.
Right. Which I think you can still buy like a version of that at the liquor store or something.
Oh, I hope not.
I think now it's Delta 8 or something.
It's so bad. I mean, I had multiple seizures on it. I remember getting high and like telling him, make it stop. Like, I was afraid, and I hated it, but then I kept doing it. Right? And I'm like, what is happening? And I think, like, looking back, that's definitely the first time that I felt powerless, you know? But at the time, I didn't know. I was 16, you know? And so that was when I started treating my parents really badly, too. I started stealing all of their stuff. My dad owns a like online auction, and so he has like a bunch of tools, a bunch of laptops, a bunch of things, and I would steal them and pawn them. My parents are amazing. They didn't deserve that, you know, but that was the closest that I was to anybody. And I also feel like I didn't care, you know. And so that was my first addiction. That guy was super abusive, very toxic, and we decided one day while we were high that we would kill ourselves together. We had a plan and everything, and I wrote suicide letters to my mom and my dad, and my mom went into my purse, probably seeing if I had drugs in there, and she found them. And she obviously freaked out, you know, her baby, you know, planning on killing myself. And so they put me in, it's called Intermountain Hospital. It's like a psych hospital.
Isn't it crazy to think about the things that we did? No,
oh, yeah.
And I know we'll get into it in a minute about you and I are both parents.
Yeah.
Thinking about now you really know that love.
I know. My poor parents.
how much that must have hurt her.
Yeah.
You know? So.
Yeah. It's so sad.
Yeah.
So I was in there for 6 days, I think. And then family visit happened, and I talked to my mom into getting me out. And when I got out, it was actually kind of weird because they stopped selling the spice in the stores.
Okay.
And so I think maybe we had like a few days worth left, and then we couldn't get it anymore. And so I believe, I don't really remember a lot around this time. I think I blocked out a lot trauma-wise. But I believe that we probably went back to just like drinking and smoking weed. And then when I was 17, I was at his house, my ex, and he was laying on the bed and he was smoking something. And I was like, what is that? And he goes, oh, it's Oxy. And I was like, oh, that's weird. And it's just random, you know. And I didn't think much of it. And then the next day, so that didn't get me. The next day, he was smoking something out of a glass pipe. And I was like, what is that? And he was like, oh, it's Oxy. And I was like, no, it's not. And he was like, okay, it's meth. And so I asked to try it. I was on Adderall and Concerta a few years of my life in the early ons, you know, for ADD. And so I was like, oh, it'll probably not affect me, you know. And that night, I was up with him all night, and this weird, like, connection happened. Not between him and I. It was, like, between something and I. And I feel like I was, like, craving some type of connection for so long. And I found it in meth, and that just started the whole spiral. Yeah. You know? Yeah. I loved meth. Yeah. You know? I mean, it's just, and I heard this saying a long time ago. It was probably while I was still using meth too. And it was like, if you want to meet the devil within yourself, do meth. And that's completely how I feel, you know? Yeah. I felt evil, and I was proud of it. Yeah. Which is crazy for me because, you know.
Right. In your core, you're a nice person from a nice family.
Yeah.
Yeah, it's interesting talking, like, to think about, like, we all kind of wind up in the same place with sobriety. Like that feeling of, like, just like you give up. Yeah. Like you're on your last day, and you're like, okay, I got to find a better way, but it takes a lot of pain to get to that place. Yeah. But, like, talking to you is so interesting because you talk to people from just so many different walks and phases of life, and you came from a happy family, a supportive family. Yeah. And, like, when you know, you and I work together, and I answer the phones a lot of times for people calling in for help, and a lot of times it's parents. Yeah. And they just don't know what they do, and they think they caused it. And definitely, I think there's things as parents we can do to mitigate and make sure that we're on top of our kids. Yeah. You know, especially with technology now. I have Finder on my phone. There's things we can do to stay in their lives and their business, but, like,
but there's only so much.
There's only so much, right?
My parents, like, if there was a book on, like, perfect parenting, that was them. Yeah. You know, and it has nothing to do with that. Yeah. And I think that, like, it probably took my mom until, like, a year and a half ago to finally accept that it's not her fault. Right. And, like, I remember having conversations with her, like, even while, like, in this sobriety, that she's like, what did I do wrong? Like, where did I go wrong? Where did we go wrong? And I'm like, it was nothing that you did.
But as a parent now, you can understand that point of view, right? It's
for
like,
sure.
You know, it's our biggest fear. And it's like, you know, my oldest is friends with Cole. He knows Cole. Like, he's like a good kid. Yeah. But yeah, he drank. Yeah. And
you never know.
You know, it didn't affect him like you and I talked about. Like, we're like, we want,
where you find this like amazing connection to something
some,
awful.
Predisposition, I think, to the whole disease concept.
Oh, for sure.
And I think our environment has somewhat to do with it. Some things to do with it.
Yeah. But I also think that, like, I mean, if I don't know. I can't look back and be like, well, if I didn't hang out with this person or if I didn't do this, then I wanted to been an addict. Because when it comes down to it, like, it's still in my core.
Right.
This is who I am. I'm sure I would have found it eventuly.
Yeah.
Might not have been 16.
Yeah.
But.
So then it fast forward to like 20. What, you're 22 when you came out here for treatment.
Yes.
And then so you looked it up online.
So it got really bad. My ex was really, really, really abusive.
So this is the same guy all the way through. So you were with this dude for a minute.
I was with him from 15 to 22.
Okay.
I mean, the last like year that I was there, it was very on and off. Like, I was trying to get away, but I was also
He had the drugs.
No, actually.
No, not anymore.
He did, but I had friends that I could go to without that. I think that it was just the abusive, that like toxic pull back to that person. And I think that there was a huge part of that was that I couldn't understand why this person who's supposed to love me was treating me like this because of the way that I was raised. Like, when you love somebody, you treat them with love and respect and tolerance.
You saw love between your parents.
Exactly.
Like true healthy love between your parents.
And so I was like, what is happening? Like, I can fix this. And so I kept going back, and obviously I could not fix it. But that last year I was trying to get away, but and there was this night, my parents don't know about this, but whatever. My mom asked me
You sure you want to talk about it?
Yes.
All right, go ahead.
A few weeks ago, my mom asked me, like, tell me your story. Like, one day I want to hear your story.
Okay.
So here you go.
Here you go, Mom. Hi, Mom.
Hey, Mom. Here you go. I ended up so my drug dealer had wrecked my car. My parents drug tested me, and I put bleach in my pee, and I don't know why. I was really messed up.
Just heard it worked to like pass a drug test.
Yeah, I heard it worked.
Yeah.
And I brought
Which, by the way, it doesn't.
No, it does not. I brought the pee cup to my mom, and she goes, "Why does this smell like bleach?" And I was like, "I don't know," like super defensive, like I have no idea. And so then they were like, "You need to get help," And so they ended up putting me into an outpatient program, and that outpatient program really helped me figure out what I needed. It was, I mean, I was just going to a couple groups, but that night that I decided that I needed an inpatient program to really deal with the trauma, that ex, he was calling and texting me like, "Where are you? Blah, blah, blah." And he actually pulled up to my parents' house with his shotgun and was going to shoot himself in the head in front of my parents' house. And so I ended up calling the cops for the first time because when my parents are involved, like that's like, when you don't have any self-worth or self-love and, you're in this toxic, traumatic relationship, you don't matter, but these people that have loved me, like I'm not going to put my parents through that. And so I called the cops for the first time. I don't really remember what happened. I don't think much. I think that they maybe drove by my house or something. And I'm just so grateful that I was there when all of this was happening, because there was a therapist and a case manager, to like walk me through and figure out that I did need an inpatient.
Yeah.
To deal with the trauma and to get like that reset. And so that's where my ideas came in. I was like, okay, fine, I'll do that, but it needs to be in Southern California and I need to bring my dog. And so
you just want to come to the beach.
Yeah.
There you go. Why not, right?
Well, I've always dreamed about living here. I don't know. I always knew that I was going to end up here. I don't know how. Yeah. But my space days, my background was actually, it went back and forth from Newport Beach and Huntington Beach when I was like 12. And so I always knew, I always had this feeling that I was meant for Orange County.
There you go.
So, but yeah, that was the time that got me out to California.
Okay. So you get out to California, and then that's the story. And then your last story you told earlier where you got sober. And then we talked a little bit offline before we got on. You have a couple of mental health diagnoses.
Yes.
When did those happen?
So when I came out to California, I went to a treatment center, the whole process. And looking back, I really think that treatment center was there in my life to help me deal with the trauma and get through that, because there was a lot, and I don't know. I mean, I can't look back and like be like, oh, I wouldn't have gotten sober, but I don't know if I would have gotten sober without working through that and like figuring that out. And at that time, when I was there, I was actually diagnosed with dissociated amnesia. So there was a couple months that I felt like, and I would talk about it like it was nothing, but I felt like I was in a coma. And I remember the exact moment that I thought that I went into a coma, which is kind of weird, but and it was all a dream.
Yeah.
And
so for people that don't know, like, give me the layman's version of dissociated amnesia. Like, what is like?
Life
what does
doesn't
that
feel
mean?
real.
Life doesn't feel real. And you forget
You're not
things,
connected.
or you forget things on. Are you just like
Yeah, like I had a lot blocked out. Like I knew something happened, but it was like I didn't feel connected to it, so it didn't feel real.
Yeah.
And I remember like talking to my therapist about it, like, did this really happen? And I mean, it comes from PTSD, so it's a side symptom of PTSD.
Is most of that trauma from your relationship?
Yes.
Do you think some of that might be from your 13-year-old situation?
I think that there's
bullied,
definitely some things.
That?
Yeah, some things that, oh, for sure. I mean, I think that everything happens the way that it's meant to.
Yeah.
And all of those things line up and go together, you know? So.
All right. So you were diagnosed with that?
Yes.
And were you diagnosed with anything else at that treatment center at that time?
I don't remember.
Okay.
Exactly.
Okay.
Probably anxiety.
Yeah. Okay.
I'm an anxious person.
Gotcha. Okay. So what was the treatment process like to help you?
So I tried EMDR.
Okay.
It wasn't it for me.
And so for people that don't know, EMDR is rapid eye movement around specific traumas.
Yes.
And if anybody wants to look that therapeutic modality up, it's something that's very effective.
Yes,
for
very
a lot of
effective.
People,
yes.
But it doesn't always mean it's going to work for you.
And I think I was trying to, I think subconsciously I was still trying to block it out, right? But my brain works well with colors. I don't know why.
Okay.
And so my therapist at that treatment center actually did, I think it's called chromotherapy, which is like, it's color therapy.
Yeah.
And so you look at this big like poster of like different colors, and I don't exactly remember how it works, but I remember her being like, okay, red. And like either it was like pointed at the red or something while you're in this like weird, kind of like an EMDR trance kind of thing, you know? Yeah. And flashbacks started. And my ex had a red truck where, you know, multiple times he almost shot himself in it, or he actually tried to run me over and hit my car with it. It was just a lot. And so I think that the red, that's what really started it. And then we went to the blue, and there was other memories that were associated with blue and, you know, all of that kind of stuff. So for some reason, my brain worked really well with that. And I know that a lot of people's brains work really well with EMDR.
Right.
I don't know why. Couldn't tell you.
Well, yeah, I was talking to Dr. Song, who's our medical director for one of our treat programs.
Yeah, for treat.
And we were talking about different modalities and different medications. He's like, you can have 10 patients with the same diagnosis and all 10 respond differently to different medications. Yeah. And it's the same with therapy.
Yeah.
It's like, these are proven modalities. They work.
Yeah.
But it doesn't mean it's going to work for you.
Minds
so,
are different.
Yeah, right?
So,
yeah.
So, yeah, I mean, it's same.
Okay, so that, and I want to look that up and make sure what's the name of that you think?
Chromotherapy.
Okay, so we're going to look that up.
I could totally be wrong right now.
Check it out. And then, Cole, maybe we could put a little slide in there exactly what it is for people that want to look that up.
It's really cool.
It sounds cool.
Yeah.
So, yeah. Okay, so you go through that therapy, and does that actually just really give you, like, major progress with that diagnosis?
It hit me out of that. Okay. It hit me out of that, like, thinking I was, like, in a coma or, like, that it wasn't real.
Yeah.
Because it was like, okay, these are real memories.
Yeah.
This is really what happened. And I don't remember all of it. I can't say that, everything came back. Yeah. No.
I know you mentioned that, like, in a previous talk you and I had, like, you forget. And I think we all forget a lot of things.
Yes.
It's
yeah.
Like,
yeah.
Our brain is supposed to forget pain, or we would be in major pain all the time. So
I think that's why I love work so much, though, too, is because I don't forget for the most part. Yeah. Of course, I'm not like perfect, but I don't forget for the most part. But like something in my brain like clicks in a different way when I'm at work, and so it just. I don't know.
Well, I've gotten that chance to work alongside you, and you're extremely organized and extremely on it.
Thank you.
And so, like, I think you really shine in that.
Thank you.
That's part of your brain that is a positive way.
Yes.
Being able to take a lot of information.
Yeah.
Keep up with it.
Yeah.
Have systematic ways you keep up with it.
Yeah.
Stay on top of things. Because that's your job. You do billing, and you're working on contracts with and network contracts with insurance companies, and there's a lot of moving parts to that stuff. So
it's so fun.
Okay, so you also said you had did I get that right before we talked? Do you have an OCD diagnosis?
I do.
So when did that happen, and when did that present itself?
So I didn't get diagnosed until 5 months ago.
Oh, this is recent.
Yeah, this is very recent.
Okay.
So, but the symptoms started. So can I go back?
Yeah, let's go back. This is your show.
Okay.
Yeah.
Because it all ties in.
Yeah. Okay.
Okay. So when I went to the second treatment center, I was also there.
This is after the relapse that we talked about earlier. Okay.
Yeah. So I started working the steps with the sponsor, and I realized that because like I said, I hated not being able to trust myself. That was a huge thing for me. And during that process, I realized that I didn't have to trust myself. I could trust my higher power. And that's something that I lived by for months.
Right.
I mean, the first year, And at that treatment center, I also went through the whole levels of care: detox, RTC, PHP, IOP, OP. And
so people don't understand, detox is the first level where you get physically removed from the substances. Residential is where you live at the treatment center and you're there monitored 24 hours a day. PHP is 6 hours a day of groups, and you either live in a sober living or you live at home.
Yes.
And then IOP is intensive outpatient. PHP stands for partial hospitalization, but I don't know why they say that, because we don't do that in hospitals, but that's what it's called. And then IOP, intensive outpatient, that's 3 hours a group a day, 5 days a week.
Yes.
And then OP is some kind of mechanic where you go daily for an hour during the week.
And then you kind of like slowly transition. I remember I went 5 days a week, and then 3 days a week, and then I think it went to 2 days a week, and then 1 day.
Right.
So.
Okay.
Yeah.
All right. So you go through all the levels of care.
Yes. And I ended up getting back together with that guy that...
With dude from home with the red truck?
No.
Oh, no. Oh, okay.
No.
Oh, your current fiance?
Yes, my fiance.
Okay.
Yeah.
The good guy.
The good guy.
All right. What's
Very
his
good
name?
guy. His name's Trey.
Trey. Hi, Trey.
Hey.
All right.
He's the best. But I got back together with him, and we, were just doing what we could. And I was working a really solid program, and a couple months went by, and I ended up getting pregnant.
Okay.
I had 6 months sober when I was pregnant, or when I got pregnant. And so that was a huge, crazy thing to deal with. I mean, newly sober emotions and like learning your emotions, like what are these? And
How
then
old were you
add
at
in
this time?
23, I think.
Okay.
Yeah. 24.
24.
Yeah, because he'll be 5 in November, and I'm 29.
Okay.
So, and learning your emotions while dealing with hormonal emotions.
Right.
Was
so when you found out you were pregnant,
wild.
I want to ask you this
Yeah.
question because my first came along when I was 24.
Okay.
And I was
Yeah.
actually sober, and I was like, what?
Yeah.
Like, I thought it was the worst thing in the world.
Yeah.
Ended up being the best thing in the
Yeah.
world. Did
Yeah.
you? How did you feel when you found out before, like
When I
day,
took the
you're like,
pregnancy test, I laughed. Like it was a stress laugh.
Yeah.
I actually have a video of it.
You're just like, oh shit, oh boy. Yeah. Okay.
Yeah. And I'm like, oh my, what a time. What a time. And yeah, I also have lupus.
Okay.
So that was like the pain that I was kind of talking about
Okay.
in high school.
Okay.
I was diagnosed at 22, so it
Okay.
took 7 years to diagnose. And so I was also high risk for miscarriages. And so it was just a lot to deal with at 6 months sober. It was a lot. But we made it through, you know. Trey was a house manager at a sober living, and I was a house manager at a sober living as well.
So you guys were both pretty newly sober.
Yeah. Well, he had a year longer than me. Yeah. A year and a half, I think.
And what's your son's name?
Giovanni.
Giovanni. And then comes along Giovanni.
Yeah.
All right.
So we moved into our first apartment 22 days before he was born.
Okay.
So, I mean, it was nice though because we got to save up, you know, being house managers, and I also got to do what I had a goal of was, you know, being at a sober living, then being a house manager.
Yeah.
I got a year sober 2 months before I gave birth, and then he was born, and
Were you at an all women's treatment center?
I was.
And an all women's sober
Yes.
living and all that?
yeah.
Okay.
Yeah. Yep.
Got it.
Yeah. And I started having a lot of fears. And it wasn't like I was super depressed, because I know that postpartum depression is so scary because it's so, I mean, obviously you love your child, but like you don't want to live. You know?
So before the postpartum, before the baby was, that's when the fear set in?
I think that I was having fears like the whole pregnancy.
Yeah.
I don't think that I truly felt fully connected to him because I didn't know if I was going to, you know, have him, which is scary. And so I think that could have played a part in, you know, when I did have him.
Yeah.
And then I'm like, well, what if God takes him away? Or, you know, and
just even the natural first parent kid thing, it's
yeah,
scary.
it's
Like,
scary.
you're
And
like,
then you
what?
add on top of like mental
Yeah.
health issues
Yeah.
and hormonal issues.
Yeah.
It's like,
I think back about how young-minded I was at 24, 25.
yeah.
And
Yeah.
I'm like, oh, wow, I was in that. And like my son now is 27. And he's a really good kid and successful and all
Yeah.
that. But like, I can't imagine him having a baby.
Yeah.
Maybe
so crazy.
like, I probably shouldn't say that on here, but like for me, how I was I was a kid.
Yeah.
You know.
Yeah.
So, yeah.
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 I had a year sober
Yeah.
after living a
Okay,
crazy
and then so
life.
Gio comes along, right?
Yes.
And when do you like kind of start feeling that depression? I mean, how does that work and how does that feel? Because postpartum depression is something that a lot of people deal with, and it's
Yes.
a very real
Oh,
thing.
it's very common.
Yeah. So
very
how did
common.
you feel? Like, was it right away? Was it after
So,
a few weeks? Or?
My mom had postpartum depression when she had my sister.
Okay.
So she had shared that with me to kind of like look out for those signs. And so I kind of had an idea My mom's amazing. We're very open with each other. And so I kind of had an idea. She also was out here for the first 2 weeks of Gio's life, helping us out.
Yeah.
And so she kind of, I was able to talk to her and kind of be open about what I was feeling. And she's like, you should talk to your OBGYN. And so I did. I think it was at my 6-week checkup is when I finally went, and like, I think actually it was a week before that, because I remember calling her and being like, okay, I need to come in and talk about that. And so she gave me some medication. I think it was Zoloft. It was a pretty low dose. And it helped tremendously.
Right away.
Yeah, pretty much. Okay. And I think that those fears and the downness that I felt, it was all very scary. Like the thoughts, like the scary thoughts, and then just like running with them in your head. Like, and I think that was kind of like the start of, being diagnosed a few months ago too. I think that I've truly just kind of been dealing with it like this whole time. And I really like to talk about mental health with addiction because for myself, up until a few months ago, I was so focused on the steps and like, if I do this perfectly, right, these fears and these thoughts will go away. God, if I give them to God, they'll go away. And I had to accept that, there's a reason why my higher power put these medications in the world. There's a reason why there's psychologists and, all of that kind of stuff. And like, there's reasons why there's therapists and all of that stuff, and it can be both. It can be both the program, the steps, your support system, your fellowship, and, figuring out your mental health.
Yeah, I mean, I heard a guy describe it the other day. It's like, our everybody pays attention to their physical health. We go to doctors, or we don't go to doctors.
Yeah.
We eat right, or we don't eat right. We know our physical health. We either go to the gym, or we don't go to the gym.
Yeah.
And so physical health, it's okay to like go, oh yeah, I'm out of shape, I'm in shape, But mental health is like the same thing as physical health.
Yeah.
But just now it's like being okay to talk about it.
Yeah.
And like everybody has a mental health state. Where you're at is, depending on what you do.
Yeah.
And I think that I'm glad it's being talked about a lot more, especially you and I come from a 12-step world.
Yeah.
And like when I got sober in the 90s the first time, there were guys that believed that taking antidepressants was not sober.
Yeah.
Because it changed your state of mind. And I saw people die that never addressed their mental health and gave the 12 steps an honest shot. I mean, I can think of 4 or 5 guys off the top of my head.
Yeah.
But they didn't deal with that side. So.
Exactly.
Yeah.
And I think that there was like this blockage from me and my higher power, and that's like the most important relationship to me. Just because, like I said, like when I first came into the rooms, like I couldn't trust myself, but I realized I could trust my higher power. And so now it's like, that's like the most important thing to me. And there was this blockage because I was living in fear, and there was nothing that I could do. Like, I remember just a few months ago, I mean, it was 7 months ago, I remember praying after I'm having these super strong OCD thoughts.
What's an OCD thought? Like, give me the rundown for somebody that doesn't know what that feels like.
Okay. Okay, so one example, and I'm going to give you example of what people normally think OCD looks like, and then I'll also give you one that it's not really talked about.
Right.
So first one is in the mornings, I always have to check my stove.
Mm-hmm.
If it's off, I go off, 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 off. And it's so funny because Gio now will go off, 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 off. And
Cute.
so,
Yeah.
and if I don't do that, so that's the whole point, is if I don't do that, so there's an obsessive thought and then a compulsion. So the obsessive thought is this will, if I don't check it, my dog will die, the cat will die,
Right.
my house will, go up in flames. Even though I know I did not use the stove that morning and I did not use the oven, it's like this obsessive thought, and I have to do something about it in order to calm myself down, right?
Yeah.
So another example is not something that you'd normally think of for OCD, but when I drop off my son in the morning, and this has calmed down a lot, and we're still trying to adjust my meds and like make sure that everything's good. But if I don't pray right after I drop him off, my head will tell me something bad is going to happen. There was even a point where I would think that something bad would happen if I thought about that something bad. So I would try to like not allow myself to think about it, because then I would obsess about it happening because I thought about it. I don't know if that makes sense. It makes
totally
sense in my
sense.
head.
No, it totally makes sense. And like what I'm thinking as you're saying that is like you've worked your butt off with 12 steps and connecting with your higher power and having a spiritual life.
Yeah.
But then that's presenting
Yep.
with your mental health diagnosis in a way that's not healthy.
Yeah. And it was
So.
And it was really, really difficult because so much of the program is trusting God,
Right.
not having fears, right? Fears will get you. And all of these fears, I could not stop, no matter what. And like, I remember crying and praying to God, and there were like kind of like two voices. Like it was my voice. I'm not hearing voices, but one was trying to pray and one was obsessing about this thought. And I remember calling my friend. She's amazing. I remember calling my friend and being like, Kristen, can you please pray with me right now? Because I cannot get my prayer out. And that was the it for me, when I couldn't pray, which is something that gets me through everything. I was like, okay, this is a problem. This is a major problem. But I had to also get into a lot of struggle before taking that, realization.
To call somebody and get
Yeah.
help, right?
Yeah.
Same thing with sobriety.
Oh, absolutely.
And it's fascinating. It's like people look at us as addicts. Like I was laughing with a guy on the phone this morning because he drank and did drugs exactly like I did. And I explained it. He's like, "Oh yeah, I get it." I'm like, he's newly sober. I'm like, as we're talking, I'm like, you understand that like this conversation is unique, right? Like if you like related to someone using cocaine so you can drink longer out on the streets, and it's just somebody that just drinks a little bit, they're going to think you're crazy.
Yeah.
It's the same thing with mental health.
Yeah.
It's like,
Absolutely.
most people are caring and loving, but just blind to what it is. And you and I know because we work in the world, in the industry, and we've all had our own struggles too, but like, to hear that, and used to in AA, you would say something like that, and it's just pray harder.
Yeah.
Or go write a 10th step, or go,
Well, and there's so
and
many
that stuff helps, but
too.
It's like, you can't help that part, and you need additional help for that.
Exactly. And I mean, I truly believed that the steps would.
Yeah.
I mean, but when it comes down to it, they helped so much. And it was just that last little thing. And I feel like there's so much more room for, like, the past 6 months, I feel like I'm so much closer to my higher power because there's nothing blocking anymore. And like, so now I can work the steps and practice these principles in all my affairs so much stronger.
Right.
Because there's not blockage there.
I love that.
So I think it's so important.
So how did you go, like when you see your therapist or your psychiatrist, or is that in person or is that telehealth?
And that's the whole thing is.
So tell me about that, like telehealth, like because that's something I want to talk about a little bit.
So that's the whole thing is like there's so many excuses that I made, you know. I'm a busy full-time working mom.
Oh yeah, you're a mom and you work.
You know, Trey's very involved. He's very, very helpful. But I'm still a mom, and I still have a very intense job, right?
I'm sure Trey's plate is as full as yours.
Yes,
so
exactly.
Having a kid doesn't mean like somebody does something, somebody does. Yeah, you guys are working your tail off.
Balance and and it's exhausting. Like I am fully exhausted every single day, and so. There's so many excuses, right? I don't have time. I don't want to pick up Gio too late because then we have to do dinner and bath time and all that stuff. Or I don't want to take off work because then I'm, too busy. Or, there's so many things, And so that's why my friend actually recommended telehealth psychiatry. Psych.
Medication.
Okay, yes.
Right? Psychologists or more therapists or LMFTs.
Yes.
Yeah, okay. So you got a psychiatrist and found a psychiatrist and
telehealth.
And you felt super okay talking to him? Were you apprehensive at first or did I'm going to see this guy on a computer screen and not see him in person? Did that thought cross your mind? You were okay with it?
I was okay with it. Okay. I think that at that point, once I finally accepted that I needed something, I was just like, okay, this is what's going to work for me. Yeah. And that's okay, right?
And do you feel as comfortable talking to him on a screen as you would in person?
Yes.
Oh, that's
her, cool. But yes.
Her.
Yes.
Sorry.
Yeah. That's okay.
See, that's like our, we call it implicit bias. And we have a whole other podcast on that stuff. Yeah. So,
So I told her everything. The first one was an initial. Going over everything. Yeah. And she went over that kind of stuff and explained to me what was going on. Because that's also another thing with me is I feel like I have to know what's going on. Yeah. Right. Especially in my mind, my brain.
I think a lot of people do, and I think that's a fair thing to know. I don't know if that's unhealthy or not. Why?
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 Why am I feeling what are these thoughts? You know, and I was truly shocked when she said OCD. I was shocked.
You were.
Because when you think of OCD, you think of counting things, right? Which absolutely is.
It presents differently for different people. Differently. But the feelings are the same, right?
Yes, exactly. It's this obsessive thought and having to do something to calm it down. Yeah. And so I was shocked. I was absolutely shocked. But I also felt so at peace because I had help, right? And that's the thing with me is I can't just know something and then not, and so I kind of ignore it until I'm ready to deal with it, and so that's kind of what the last few years have been like. I'm just.
Do you go to therapy or do you just see your psychiatrist and do the program?
I see my psychiatrist and do the program. I should go to therapy. It's just one of those,
On the to-do list.
Yes, on the to-do list. But I'm definitely going to do the telehealth therapy because, it's just, like I said, busy mom and
it's convenient. We learned through COVID, I think that
we can do anything through
is a very viable modality.
Yeah.
The place that you and I work for, Treat Mental Health California, Treat Mental Health Texas, Treat Mental Health Tennessee.
You can do anything.
We've learned that having that modality gives more access to people that need help.
Yes. And it doesn't have to feel too much for a busy working mom.
And that's
a big deal. Or a dad.
A lot of people feel more comfortable opening up in their own home, in their own space.
Yes. Because you're not sitting on this new couch.
And with that being said, it's not for everyone.
Yes.
And that's okay too. For example, me, I have no problem seeing a doctor. I have no problem seeing a psychiatrist. But when I go to therapy, like once a month, I want to go sit in front of someone, but I'm not a technology native. I grew up in the 70s, 80s,
Yeah.
you know, but like, that's what I enjoy.
Yeah.
Could I do it? Yeah.
Yeah.
Am I against it? No. Have I seen like it have extremely positive effects? Yes.
Yes.
Okay, so we've got a little bit of time left. So you and Trey are getting married.
Yes.
What does your life look like today? Now that you've done all this work, you're 6 years sober. Your fiance's 7 years sober.
Mm-hmm. He'll have 8 years in October.
And
no.
And he's got some time.
He has 7 years in October.
7 years. Okay. And so
Yes,
Gia's 5. Mm-hmm. And so you got a 5-year-old. I have a 5-year-old too.
No, he'll be 5 in November.
He's gonna be 5.
Yes.
He's coming up on 5.
Yes.
Okay. So what is like what is life like now? Just
My
like give me
life
like
is-
a couple minute like blurb, like what's life like now that you've done all this work, and obviously you're still working at working
Yeah.
through things, and it never ends. But
Yeah. My life is absolutely beautiful. It's not perfect.
Right.
Nothing can be perfect. I'm not where I want to be. So there's still growth, motivation for growth too.
Yeah.
But it is absolutely beautiful. I thank God every single day for the beautiful life that I've been given.
Right.
I mean, I live in Southern California, where I imagined
Right.
living at 13.
Yeah.
And I came out here because I needed help, right? And I gained this beautiful life. And I had a few miscarriages in my life, while using, while not using, all of those things. And when the time was right, God made it happen after I had handled everything that I needed to, and I have an amazing man, I remember when I was trying to get out of that relationship, I would pray for a man like Trey.
Mm-hmm.
And now I have that.
That's beautiful.
And I have a beautiful child. Oh gosh, he's a crazy little guy.
Yeah.
And he keeps you on your toes.
Yeah.
But I mean, I have such a beautiful life. I'm a really good employee.
You are.
And
I'll vouch for that.
Thank you.
Yeah. I get to work with you. You're not my employer. Those are the guys I employ, but gosh, you guys are awesome back there. So, yeah.
We work for the best company.
Yeah.
I mean, and that's another thing is like you gotta like enjoy. You gotta figure out where you can improve, right? And like, I'm never somebody that's like, no, I know everything.
Yeah.
I'm like, oh, if you know more than me, help me,
Always be teachable, right?
And
Yeah.
I left a company that I wasn't happy at.
Yeah.
For almost 4 years, and I found a company that values me, and respects me, and that's amazing. So I think that just like going into those uncomfortable times, right? Like I was so uncomfortable when I left my last job. I was so uncomfortable when I became a mom. I was so uncomfortable growing with another human, like my partner, and like growing together in like different ways with Trey. But at the same time, together it's uncomfortable. But there's so much growth that comes out of being uncomfortable, and you just got to get through those little tough times, and also know that everything happens the way that it's meant to.
Right.
And like in that moment, you might not know why it's happening, but then years later, you're gonna look back and be like, "That's why this happened."
Mm-hmm.
Whether it's for growth or for a lesson learned, or anything. It's just everything happens the way that it's meant to.
Yeah.
So yeah.
That's neat. Okay, last question.
Yes.
Ask everyone this.
Okay.
What's your message to someone that's out there struggling with mental health or addiction? What do they do? Where do they do? Where do they go? Where should they turn?
Call and ask for help.
Okay.
Look up, like me. I literally looked up a treatment center in Southern California that accepts dogs.
Yeah.
Like, there was that moment that you're like, okay, like I need help. Or even just being like, hey, like knowing somebody that also has something, like my friend, when it came to going to a psych, I knew that she had somebody, and she, gave me that referral, asking for help, because you're not alone. And there's so many people out there that are dealing with mental health and substance abuse and alcohol addiction, all of the things. There's so many people, and none of us are alone in that. It might look different. A lot of it looks different, but we all are struggling with something. And I think that it's a huge thing to know.
Yeah. Okay. Love it. Thank you so much for coming on. This was such an awesome podcast.
Good.
I really enjoyed it. All right.
Thank you so much.
All right. Bye-bye.